I want to talk to you today about one of the most surprising and easily missed ways the heart can signal trouble, and a pattern that makes it especially recognizable once you know it. Tooth, jaw, or gum pain that comes on specifically when you exert yourself and eases when you rest, and why this exertional pattern can point to the heart even when the pain is felt in the mouth. Because we'd never connect tooth or jaw pain to the heart, and certainly not pain that comes on when we walk uphill or climb stairs. Yet the heart can refer pain to the jaw and teeth, as I've discussed, and when such pain follows the exertion and rest pattern of angina, it can genuinely be the heart. So recognizing this pattern is genuinely important. So today I want to explain why the heart can cause exertional tooth and jaw pain, why the exertional pattern is such a useful clue, how to tell it from dental pain, why it matters, and what to do, with the crucial guidance in partnership with your doctor, your dentist, and emergency services. And I'll be clear and direct, because while most tooth and jaw pain is dental, exertional tooth or jaw pain following the angina pattern can be the heart, and recognizing it can save your life in partnership with these professionals. This is about recognizing a surprising but genuinely recognizable cardiac pattern. Let me start with why the heart can cause tooth and jaw pain, because I've touched on it and it grounds this. As I've discussed about referred pain, the heart can cause pain felt in places other than the chest, including the jaw and even the teeth, because the nerves carrying pain from the heart share spinal levels with those from the jaw and teeth, so the brain can interpret heart pain as coming from these areas. So heart problems, angina, or a heart attack can be felt as jaw or tooth pain. Today's focus adds a crucial recognizable feature, the pattern. When heart-related pain is angina, the pain that comes from the heart not getting enough blood during exertion, it characteristically comes on with exertion and eases with rest. And this exertional pattern can apply even when the pain is felt in the jaw or teeth. So heart-related tooth or jaw pain can follow the angina pattern, coming on with exertion and easing with rest. So the heart can cause tooth and jaw pain through referred pain, and when it's angina, this pain characteristically comes on with exertion and eases with rest. So understanding referred pain plus the exertional pattern is the foundation. So the heart can refer pain to the teeth and jaw with an exertional pattern. Let me explain why the exertional pattern is such a useful clue, because it's the key insight. The exertional pattern is a genuinely useful clue because it's characteristic of the heart and uncharacteristic of dental problems. Angina, the heart pain of exertion, classically comes on when the heart works harder, walking, climbing stairs, exertion, or sometimes after a large meal or in the cold, and eases within minutes of resting, and recurs with exertion, often at a consistent level. So when tooth or jaw pain follows this exact pattern, coming on reliably with exertion and easing with rest, that pattern strongly suggests the heart, because dental pain doesn't behave that way. A toothache from decay or a dental problem isn't brought on by walking uphill and relieved by standing still. So the exertional and rest pattern is a powerful clue that tooth or jaw pain might be the heart, even though the pain is felt in the mouth. So the exertional pattern, pain coming on with exertion and easing with rest, is a powerful clue pointing to the heart, since dental pain doesn't follow that pattern. So the exertional pattern is the key recognizable clue. So exertional and rest tooth pain strongly suggests the heart. Let me help you tell this from dental pain, because that's the practical heart of this. While you can't reliably tell yourself, the features that suggest tooth or jaw pain might be the heart, especially the exertional pattern, are worth knowing. Heart-related tooth or jaw pain characteristically comes on with exertion, like walking, climbing stairs, or effort, and eases within minutes of rest. Recurring with exertion, the angina pattern may come with other heart symptoms, chest discomfort, breathlessness, sweating, or pain in the arm, shoulder, or neck. Is often a deep, aching, or pressure-like discomfort rather than a sharp, localized dental pain, and isn't related to a specific tooth, to biting, hot or cold, or to dental triggers. By contrast, dental pain is related to a specific tooth, biting, chewing, or hot and cold, follows dental problems like decay or infection, is reproducible with dental triggers, and isn't brought on by exertion and relieved by rest. So tooth or jaw pain that comes on with exertion and eases with rest, especially with other heart symptoms and not linked to a specific tooth or dental trigger, suggests the heart, while pain linked to a tooth and dental triggers suggests dental. So the exertional pattern and lack of dental triggers distinguish heart-related tooth pain. So read tooth pain by its exertional pattern and triggers. So the exertional pattern distinguishes it from dental pain. Let me give the crucial guidance, because this is where it matters most. Here's the crucial guidance. If you have tooth or jaw pain that reliably comes on with exertion and eases with rest, this could be angina and warrants seeing your doctor promptly for assessment, even if it's not an emergency at the moment, since angina is important to diagnose and manage, and this exertional pattern strongly suggests the heart, despite the pain being in the mouth, so it shouldn't be dismissed as dental. And, crucially, treat as a possible heart attack and call emergency services immediately if tooth or jaw pain is accompanied by chest discomfort or pressure, breathlessness, sweating, nausea, lightheadedness, or pain in the arm, shoulder, or neck, comes on at rest and is severe or persistent, or makes you suspect your heart or feel very unwell, since this can be a heart attack felt in the jaw or teeth. Don't dismiss exertional tooth or jaw pain as dental, or wait when it follows the heart pattern or has these features. So see your doctor promptly for exertional tooth or jaw pain that eases with rest as possible angina, and call emergency services for tooth or jaw pain with heart attack features. So act on exertional tooth pain as possible heart. So exertional or symptomatic tooth pain warrants heart assessment or emergency care. Let me explain why this matters so much, because dismissal is dangerous. This matters because tooth or jaw pain that's actually the heart is genuinely at risk of being dismissed as dental and taken to the dentist, instead of getting heart assessment or emergency care, delaying the diagnosis of angina or the treatment of a heart attack. The exertional pattern is the saving clue. Recognizing that tooth or jaw pain coming on with exertion and easing with rest behaves like the heart, not like a tooth, can prompt the right action. And, as I've discussed, in a heart attack, time is muscle and lives, so delay is catastrophic. So recognizing this exertional pattern and the heart features, rather than assuming all tooth pain is dental, can prevent dangerous dismissal and delay. So this matters because heart-related tooth or jaw pain is easily dismissed as dental, risking delayed angina diagnosis or heart attack treatment, which recognizing the exertional pattern prevents. So recognizing the exertional pattern prevents dangerous dismissal. So it matters because dismissal can be dangerous or fatal. Let me keep balance because most tooth pain is dental. Let me be balanced. Most tooth and jaw pain is genuinely dental, from decay, infection, gum disease, or jaw problems, and is a matter for your dentist. And I don't want you to fear that every toothache is your heart. The vast majority of tooth pain is dental, related to specific teeth and dental triggers, not exertion. The specific pattern that should make you think of the heart is the unusual one. Tooth or jaw pain that comes on reliably with exertion and eases with rest, especially with other heart symptoms, or that comes with heart attack features. So heed that specific exertional or symptomatic pattern while treating ordinary dental pain as dental. So most tooth pain is dental and for your dentist, while the specific exertional or symptomatic pattern is what should make you think of the heart. So keep balance. Ordinary tooth pain is dental. The exertional pattern is the heart clue. So most tooth pain is dental. Heed the exertional exception. Let me be clear about what to do, because the response should match the pain. So here's what to do. For tooth or jaw pain with heart attack features, chest discomfort, breathlessness, sweating, nausea, or pain in the arm, shoulder, or neck, or severe pain at rest, call emergency services immediately as a possible heart attack. For tooth or jaw pain that reliably comes on with exertion and eases with rest, See your doctor promptly as possible angina, treating any new or worsening exertional pain as a possible emergency. For tooth or jaw pain clearly related to a specific tooth, biting, hot or cold, or dental problems, see your dentist for the dental cause, though mention it if you're unsure or it has any unusual features. And if you're ever unsure whether tooth or jaw pain might be your heart, especially with the exertional pattern or heart symptoms, err on caution and seek help. So call emergency services for tooth or jaw pain with heart attack features. See your doctor for exertional tooth pain that eases with rest. See your dentist for clearly dental pain, and err on caution when unsure. So match your response to the pain, erring on caution. So respond per the pain's pattern, cautiously. Let me paint you a quick picture of how this matters. Picture a man in his 70s who notices that whenever he walks up a hill or climbs stairs, he gets an aching pain in his lower jaw and teeth, which goes away when he stops and rests, and which he's been puzzling over and planning to take to his dentist. Understanding that tooth or jaw pain, coming on reliably with exertion and easing with rest, follows the angina pattern and can be the heart, even though it's felt in the mouth, he instead sees his doctor promptly, who recognizes the exertional pattern, assesses him, and diagnoses angina from heart disease, which is then managed, and his cardiovascular risk addressed, preventing a possible heart attack. Had the pain come with chest discomfort and breathlessness, he'd have called emergency services. The same man, but recognizing his exertional tooth pain as a possible heart sign, rather than taking it to the dentist, got angina diagnosed and his heart protected. That contrast is exactly why recognizing this surprising but recognizable pattern matters so much. Let me speak briefly to those of you caring for an older parent or partner. Understand that the heart can cause tooth, jaw, or gum pain, and that when such pain comes on reliably with exertion and eases with rest, the angina pattern, it can be the heart even though it's felt in the mouth and is easily dismissed as dental. You can help by recognizing that exertional tooth or jaw pain that eases with rest is a heart clue, and encouraging a loved one to see their doctor promptly rather than only the dentist. Crucially, treat tooth or jaw pain with chest discomfort, breathlessness, sweating, nausea or pain in the arm, shoulder or neck, or severe pain at rest as a possible heart attack, and call emergency services immediately. For clearly dental pain, see the dentist. Helping a loved one recognize the exertional pattern as a possible heart sign can get angina diagnosed and protect their heart, even saving their life. So let me draw this all together. Tooth, jaw, or gum pain can, surprisingly, be the heart, because the heart refers pain to the jaw and teeth, and a powerfully recognizable clue is the pattern. When such pain comes on reliably with exertion, like walking or climbing stairs, and eases within minutes of rest, that's the angina pattern, which strongly suggests the heart, since dental pain doesn't behave that way. Heart-related tooth or jaw pain is distinguished by this exertional and rest pattern, by accompanying heart symptoms, and by not being linked to a specific tooth or dental trigger, while ordinary dental pain is linked to teeth and dental triggers. Most tooth pain is genuinely dental, but the exertional or symptomatic pattern is the heart clue not to dismiss. So see your doctor promptly for exertional tooth or jaw pain that eases with rest as possible angina. Call emergency services for tooth or jaw pain with heart attack features. See your dentist for clearly dental pain, and err on caution when unsure. So here's what I'll leave you with, straight and clear. First, understand that the heart can cause tooth, jaw, or gum pain through referred pain, so heart trouble can be felt in the mouth. Second, know the key recognizable clue. When tooth or jaw pain comes on reliably with exertion, like walking or climbing stairs, and eases within minutes of rest, that's the angina pattern, which strongly suggests the heart, since dental pain isn't brought on by exertion and relieved by rest. Third, recognize the features distinguishing heart-related tooth or jaw pain. The exertional and rest pattern, accompanying heart symptoms like chest discomfort, breathlessness, sweating, or arm or neck pain, a deep aching or pressure-like quality, and no link to a specific tooth or dental trigger. while dental pain is linked to teeth, biting, hot or cold, and dental problems. Fourth, see your doctor promptly for tooth or jaw pain that reliably comes on with exertion and eases with rest as possible angina. And, crucially, treat tooth or jaw pain with heart attack features, chest discomfort, breathlessness, sweating, nausea, or pain in the arm, shoulder, or neck, or severe pain at rest as a possible heart attack, and call emergency services immediately, not dismissing exertional or symptomatic tooth pain as dental. And fifth, keep balance. Most tooth pain is genuinely dental and for your dentist, so heed specifically the exertional or symptomatic pattern as the heart clue. See your dentist for clearly dental pain, and err on the side of caution and seek help when unsure. The heart can signal trouble through tooth and jaw pain, and the exertional pattern is a powerful clue. So recognizing it and acting can get angina diagnosed or a heart attack treated, saving your life, which is genuinely important. So take care of yourself, recognize exertional tooth or jaw pain as a possible heart sign, act urgently on heart attack features, and see your doctor or dentist as appropriate. And because heart-related tooth or jaw pain follows an exertional pattern and is easily dismissed as dental, please treat tooth or jaw pain that reliably comes on with exertion and eases with rest as your reason to see your own physician promptly for possible angina, and such pain with heart attack features as your reason to call emergency services immediately while seeing your dentist for clearly dental pain.